It's hard to describe what you see in Ethiopia. It's almost like being transported back into the 17th and 18th centuries. Now, I don't mean that in terms of a denigrating way of saying it, but this population of this country is 90 million. And when we last inquired, there was something like 127 surgeons for the country. Not maxillofacial surgeons, we're talking about surgeons in general. So what that tells you is that there is not enough medical personnel to treat the disease in the country. So if you're really sick, you get a cancer, by and large, it's terminal. And the chronic diseases that just go on and grow bigger and get enlarged grow to grotesque proportions. We have infections which have eaten away the cheeks, the lips, the nose. What people don't realize is that actually your lips hold your teeth in. And without lips, your teeth go out, your tongue pushes on them, just like orthodontic brackets. And these kids will have teeth that are splayed out if their lips have gone with Noma. And actually they do look awful, they can look awful in their parents.
It's really, really emotional to see how disfigured they are, how much they struggle, how long they've been struggling with, not being able to talk, not being able to eat, and often being kept in isolation because it's often considered a curse. It's embarrassing for the families, so the children don't go to school, young women don't get married. An insult that they often tell us that they receive is being called open, which people find very, very offensive. So literally if they've got mouth closing issues or big wounds around their mouth, they're called like open mouth.
The cases that are picked up by the outreach team with Project Harar are so extreme. Even though I work in this field in the UK, there's no way I would ever be exposed to the kind of things that people are presenting with because they'd be picked up so much earlier on.
None of us have faced such gross disease, and it really extends you to the limits of what you can do, and it takes time to work this out. And we're into patterns now, and we know how to do it, but it's taken those years to learn, and that's why these international teams are fantastic, because you're learning off each other.
I don't think Belete would have survived if he hadn't had the surgery. It was that severe. When he came to us, he had been accidentally shot at a wedding and had really severe injuries to the side of his face. His whole cheek was hanging off and his cheekbone was exposed. His lip had been torn off as well. And his surgery was obviously really major, and we nursed him through all of that. And then this year, to see that he came back, that was really, really emotional. His face had healed incredibly, like the most amazing result. He came for a small amount of corrective surgery, but was so thrilled that he had his life back to normal. He was able to eat and drink, and was actually a really good-looking 19-year-old guy.
Some of the equipment we'll be using in this theatre might be £1,000 for the reconstructive plates. Out there, the whole patient mission is £1,000 per case. You couldn't afford one instrument to be like that. So you're having to all the time adapt and make up. Where your heart really sinks is when you're operating and you're faced with something and you say, can I have this? And they say, we haven't got this. And you literally have to stop and think, okay, what have we got then? Can you just open all those trays and let's see if we can find a way around this?
When word gets around Addis that there's a surgical team kind of in town, lots of people will make their way to the hospital and often sit outside theatres for many hours waiting to be seen.
There's some heart-rending stories, and some of these where you just can't treat them. Where this comes about is not that you can't fit them in, but the disease is past what you can do. And so you just have to say to them, you need to take these kids back home again. And you see a bus going on, perhaps 2 days into the mission, and they're the kids or the adults that are just past treating. What I've found is you feel pathetic at that point, because they never argue, they never remonstrate, they simply look at you and they turn around and leave. And then on the other hand, there's some lovely ones. I can remember a girl, and I think she had Noma. We reconstructed the cheek for her, and normally they'd go back to the village, you wouldn't see them again. And in fact, she walked back. She wasn't brought by Project Rouse. She actually made her own way, and she came back just to let everyone know that she'd got married. And that was her way of, expressing her thanks. And then she turned around and walked off back.
So one of my favourite bits of the trip is offering the patients a mirror for the first time after their surgery. And we send some of the volunteers out when we ran out of mirrors to pick up these little handheld mirrors that they can keep and go home with. Some of the patients haven't even looked in a mirror before in their lives anyway. And so to see their reflection is so emotional. In that moment, their whole life changes. Sitting with them on a bed when they look in the mirror and see their new nose, which has been reconstructed by moving tissue around their face, is incredible.
People are lost. What I mean by lost is that if you're a child or an adult with a gross deformity, and you don't know where it's going to get fixed, you don't know, you're just lost. And then someone finds you, and then out of the blue comes an opportunity to have something fixed. Once we've finished operating on them, they have changed faces, and their beaming smiles as you leave are a fantastic reward to us. And their lives are transformed from being outcasts to now being able to go back to school, to be part of the community, and some of them to get married, and really just being brought back into society rather than being left outside it.